Hi, my name is Shabdavi Chandran and I'm a second year MPH candidate. For today's presentation, I've chosen to cover one of the most well-known environmental crises in modern day America, the Flint water crisis. I'll go over the causes and impact and also the policy failures that contributed to this crisis. We'll first be seeing about the overview of the event, the causes, the impacted populations, the current events, solutions, and the connection to broader systems. First, coming to the overview of the event, Flint is a city located in Genesee County in Michigan. The event we are discussing today started in 2014, at which time the population of Flint was roughly 100,000 residents. It is important to note that a majority of them were predominantly Black or African American, with a significant portion of them also living below the federal poverty line. So these socio-economic factors become relevant later as we discuss the environmental justice. Since 1967, Flint has been receiving their water from the Detroit Water and Sewage Department, which is sourced from Lake Huron. In the early 2010s, with the city facing financial emergency, the county announced their plans to terminate their contract with Detroit Water and shift the water source to the Flint River. So this switch was finalized on April 25th, 2014, despite rising concerns from various sources, including a worker within the Michigan Department of Environmental Quality. Starting June 2014, multiple cases of Legionnaire's disease was identified in the Flint area. This prompted the city to announce boiling advisories in August and September. In October, the General Motors engine plant, which is located in Flint, announced that they stopped using Flint tap water because of high levels of chloride corroding engine parts. By January 2015, there was multiple troubling signs, but the city administration refused to move back to Lake Huron water, citing the higher rates. Residents started complaining of health issues in community meetings. The city EPA manager detected high levels of lead at the home of a Flint resident. In a highly questionable move, emergency manager struck down the city council's vote to move back to Detroit Water in March. So from June to September of 2015, the scientists detected high levels of lead in multiple homes, while the administration, which is including the mayor, continued to publicly deny concerns. Following multiple studies, including a study that showed an increased number of children with high levels of lead in their blood after the water source switched to the Flint River, the Michigan governor signed a bill to reconnect to Detroit Water in October 2015. This was followed by emergency declarations in the county and the state. As Flint began the slow process towards recovery, multiple government and public health officials were found guilty of criminal charges for their roles in the crisis. Studies later revealed that the crisis could have been avoided with early action and attributed the inaction of officials in the early phases to various socioeconomic biases. By 2024, Flint had replaced a majority of the lead water pipes. The primary hazard in the crisis was lead contamination. The 1991 Lead and Copper Rule recommends orthophosphate for corrosion control, but this was ignored in Flint. Apart from the ill effects of lead in water, there were multiple other irregularities. Flint officials and MDEQ falsely claimed compliance using flawed sampling methods that underreported lead. So, warnings from residents, scientists, and medical researchers were ignored, delaying the recognition of a public health emergency. Structural racism was rampant, with a lot of the affected population being from minority races. Bradford Hill criteria supports the causal relationship between switching to Flint River as a water source and the elevated blood lead levels in Flint residents. Hurley Medical Center pediatrician Mona Hanna-Disha published a study that showed a statistically significant correlation between elevated blood levels and the water source change. The elevated lead levels were also confirmed in multiple other studies. Further, this was specific to Flint households that were exposed to the Flint River water without corrosion control, and there were clear temporality indicating that the health complaints started after the exposure. Further, there was also a dose response relationship with higher lead concentration in water correlating with higher blood lead levels. So these findings are also supported by scientific knowledge. Switching back to Detroit water reduced the lead levels in water, further supporting the causality. Finally, similar effects were also seen in the Washington, D.C. crisis, where absence of corrosion control resulted in elevated lead levels among children. The Flint water crisis did not affect everyone equally. Children, especially those under the age of 6, were among the most vulnerable. Lead is a potent neurotoxin, and even low levels of exposure can cause irreversible developmental harm in children. According to the CDC, the reference level of concern is 3.5 micrograms per deciliter. Yet in some Flint neighborhoods, nearly 11% of children exceeded that threshold. So that means entire communities of young children now carry an elevated risk for cognitive deficit, behavioral problems, and long-term educational challenges. But the crisis wasn't just biological, it was social and political. Flint is a majority black city where over 40% of residents were living in poverty. Residents' complaints were ignored for over 18 months, even as the water turned brown and the children got sick. A 2017 report by the Michigan Civil Rights Commission concluded that this was not just neglect but was systemic racism. They argued that a wealthier, whiter community would not have been treated the same way. The mental health effects were just as profound. Years later, studies showed that more than 40% of Flint adults exhibited signs of depression, and over 30% showed symptoms consistent with PTSD. So, beyond the numbers, this speaks to a breakdown in trust. Residents felt abandoned by the very systems which was meant to protect them. As of 2025, Flint has made measurable progress in rebuilding its water infrastructure and restoring some trust in public systems. Over 97% of known lead service lines have now been replaced, supported by both state and federal investments. Current water quality in Flint meets the EPA standards under the lead and copper rule. Regulatory compliance alone does not equate to community confidence. The legal system has taken steps towards accountability. The $626 million settlement approved in 2021 was a significant moment. Much of it is earmarked for children, those most harmed by lead exposure in their developmental years. But financial compensation cannot undo the years of harm. Behavioral health remains an ongoing concern. Flint continues to report elevated rates of depression and PTSD, with community organizations now embedding trauma-informed approaches into schools and care systems. These mental health needs will likely persist for years. Crucially, Flint's story also triggered a national awakening. Jackson, Mississippi water crisis in 2022, affecting another predominantly black community, revealed that these are not isolated events. In response, the EPA launched a $50 billion initiative through the bipartisan infrastructure law to rebuild aging water systems, which prioritize historically disadvantages historically disadvantaged areas. Flint has thus become a symbol of both injustice and the need for structural reform. To prevent another Flint, the solutions must go beyond the pipe replacement. We need a multi-layered response that addresses the root cause of the crisis. At the infrastructure level, ensuring corrosion control is non-negotiable. Lead pipes are still present in many US cities, and without proper treatment, the risk remains. The city of Denver is a prime example, with Denver Water aiming to replace all the lead pipes within the city with copper pipes through the lead reduction program. Proactive monitoring and rapid response to contamination events must become the norm. Stronger regulatory oversight is essential. The Flint crisis has exposed how fragmented and unclear responsibilities were across agencies. The EPA and the state agencies must be held to higher standards of responsiveness with improved coordination and transparency. On the legal front, policies need to prioritize health over cost cutting. Flint's emergency managers made financial decisions that jeopardized lives. The city administration had multiple opportunities to shift to Detroit water, but preferred not to do so due to cost concerns. Future governance frameworks must embed public health protection into all decision making, especially when managing basic needs like water. And finally, resident voices must be central. Flint residents raised red flags early, but their concerns were dismissed. A just solution involves community partnership, not paternalistic decision making. Embedding environmental justice principles into every step from policy to implementation is the only way forward. A robust warning system leveraging the modern technology will also help improve transparency and raise public trust. Flint didn't just happen in a vacuum. It was an outcome of a broken system where multiple safeguards failed. From a systems thinking lens, we see that Flint represents a failure in feedback loops, governance, and trust. Infrastructure governance broke down, that is, the aging pipes were neglected, and cost saving took precedence over safety. Regulatory oversight failed. Neither the EPA nor the state agencies intervened when they should have. Emergency management failed. The state appointed managers made decisions without local accountability, and communication failed. Residents and scientists were ignored despite raising the alarm. In public health, we think in terms of prevention. Flint missed every level. Primary prevention like corrosion control was ignored. Secondary prevention such as blood lead testing and early clinical screening was delayed. And tertiary responses like legal settlements and health programs only arrived after the harm was done. So the lesson from Flint is clear. Technical solutions alone aren't enough. Systems must be restructured to build in accountability, trust, and justice. Thank you.